Hello, welcome to this training video as part of the Positive Behaviour Support in Early Childhood series and funded through the Regional Community Childcare Development Fund. This training video is focusing on active supervision and is part of a series of 5 in this phase 2. I would first like to begin by acknowledging the National Centre on Early Childhood Health and Wellness for the materials used in this training video. First, we'll start with looking at the National Quality Standards Framework and where active supervision sits in with this. So it links very clearly to Quality Areas 2 and 5. Quality Area 2, looking at creating environments that are safe and responsive to the needs of the child and helping protect children from hazards that may arise from their play and daily routines. It also links very strongly with relationships with children, Quality Area 5, where educators engage in meaningful and positive interactions with children. In addition to this, if we have a look at the Early Years Learning Framework Outcome 1, children have a strong sense of identity. They feel safe, secure and supported. They're developing their emerging autonomy, interdependence, resilience and sense of agency in the world. And number 3, children learn to interact in relation to others with care, empathy and respect. So for educators to promote this learning, they need to spend time interacting and conversing with each child, show encouragement and enthusiasm for children's attempts at learning, and support their efforts. And in particular, looking for opportunities to have one-to-one interactions with all children in their care. So let's start and look at why do we supervise children? And traditionally, I think when I first began in education, when I was actively supervising students, I would find myself a place and look out and be watching for misbehaviours, stand and watch for problem behaviour and then intervene into that. What we actually know from the research now, that simply having an adult presence and attending to inappropriate behaviours is actually insufficient and ineffective as an intervention practice. Evidence shows that there is a lot more to effective supervision. And in this training video, we will look at shifting the mindset and looking at active supervision as an important preventative strategy. As I mentioned in the previous slide, active supervision is an evidence-based practice, and it's shown to foster and promote a positive environment with consistent, clear expectations for children. In Module 1, we looked at clearly defining and teaching expected behaviours. Active supervision is the follow-up and ensuring that we give every child assistance to meet those expectations, encouragement for when they do meet those expectations. And those frequent encouragements, giving specific positive feedback, are those daily interactions that build positive adult-child relationships. And as we talked about in the previous training video, allow for high rates of encouragement and positive feedback to students when they are doing the right thing. In addition to that, active supervision evidence also shows that it is highly effective in reducing inappropriate behaviours and allows for timely correction of behaviour errors. We also know that when adults in education settings use active supervision effectively, it increases child's sense of safety and decreases bullying. Think about it when you're an adult and you're driving on the road. If you see a police patrol car or a policeman, you are much more inclined to be carefully following the road rules and keeping your speed limit there. The same with young children. Seeing adults around is a reminder for them to be actually, as much as they can, following those expectations. Some of the principles of active supervision. It is a very, very important caregiving strategy, and there are a set of skills that educators can develop and master to ensure that all adults in the service or the school are actually using the same set of principles of active supervision consistently with students. It's a combination of watching children play, listening to them, being aware of the environment, potential risks, the conditions, and also knowing the children as well. Active supervision is more than just watching out for behaviour errors to occur. It requires focused attention and intentional observation of children at all times to ensure that they are safe. So, the 6 active supervision strategies that we're going to talk through today come from the National Centre on Early Childhood Health and Wellness at the Office of Head Start, where they have identified 6 strategies for educators to be using to ensure that children in care are kept safe. They are: number 1, setting up the environment; 2, position educators; 3, scan and account; 4, listen; 5, anticipate children's behaviour; and number 6, engage, encourage, extend, and redirect. The first active supervision strategy is setting up the environment so that there are clear sightlines and access to all children at all times. Educators can see the children and the children can see the educators. So furniture that should therefore be at waist height or shorter, small areas are kept clutter-free, and big spaces are set up so that children have clear spaces that educators can observe. Number 2, positioning educators so that you can see and hear children at all times. So is there agreement in your centre about where are the best places for adults to be actively supervising all students at all times? Making sure also that there are clear paths to where children are playing, eating and sleeping. So if needed, educators can get to children in a very short amount of time if there are problems. And the other thing is positioning educators is using proximity. Staying close to children who may need extra support, or using proximity in areas where you can see or anticipate a problem occurring and get in there quickly to intervene in that. Number 3, scan and account. So continually scanning the environment and regularly counting children to actually know that they are safe. Why is scanning important? Well, it extends the ability to supervise large areas and numbers of children in care. It allows educators to detect problems early and intervene early before they escalate. And really vitally important, it increases opportunities for positive contact. And the other thing, it lets children know that educators know what's going on and will be there when needed. Scanning, what does it look like? Frequently and intentionally. All children are observed on a very regular basis. You're visually sweeping the areas, making eye contact with children in more distant locations. And if you are working with an individual or a small group, positioning yourself so you can look up and scan the entire room or get up and scan occasionally. When you're scanning, you are targeting and looking both for appropriate behaviours so that you can have the opportunity to provide specific feedback to students, or also looking for behaviour errors so that you can actually provide corrections to students. Remember, when you're using the paints today, use your gentle hands. Remember, walk carefully and hold the bucket so the water stays inside the bucket. The next active supervision strategy is listening. And listening is around looking for sounds or absence of sounds and signifying reasons for concern. Educators, caregivers who are listening closely to children immediately identify signs of potential danger, either through raised voices, angry voices, upset voices, or sometimes even absence of sound. Things have gone quiet. Is there something we need to look into as well? In addition to that, early childhood programs that think systematically about active supervision may implement additional strategies to safeguard all the children in the care. For example, a great idea, having a bell when a door opens to alert adults that the door is opened and to have a check to make sure that a child has not left or entered the room. Number 5, Anticipating children's behaviour. It is really important for educators to know each child's interests, abilities and skills, and also know when they might wander or get upset, so that staff can use this to predict what children may do. They also use this to create challenges for children who are ready for it and support them in succeeding. Information also from daily health checks about illnesses, lack of sleep, things going on at home, help to inform staff and assist them to anticipate children's behaviour throughout the day. If we know what's going on, we know what to expect, we're better able to protect children from harm and better able to provide additional support if needed. The final active supervision strategy we're going to talk about today is engage, encourage, extend and redirect. So in this one and in many of our training videos before, we have talked about how important it is for educators to provide frequent positive interactions to students at least a minimum of a 4:1 ratio. They also know when to encourage and extend students when they're engaged in activities, and also to redirect as needed. Sometimes this might be where you will be using pre-corrections with children, you're watching them do an activity, you know what the expected behaviours are, so you can provide a quick pre-correct and then provide them with some feedback or, if required, some redirection on their behaviour as well. The other thing we know is that often children who come from traumatised backgrounds need repeated opportunities of positive exchanges with adults to change the lens they carry about how relationships are experienced. So the use of active supervision is a perfect opportunity to be looking for those opportunities with all children to provide specific positive feedback at frequent rates. And in this slide, I think we absolutely emphasise the point that the adults in the centre are the most powerful tool we have with working all young children. And so using strategies where we greet children by their name, we catch them doing the right thing, we get down and talk to them. All of the staff are consistent in their expectations and their responses with children. We tell them it's okay to feel sad, angry or hurt, that they're going to be okay. And we spend as much time as we can interacting with our students so that they get those daily interactions at a high level. One centre we worked with used and made this lovely poster and had it displayed to remind the adults in the centre around the elements of active supervision. They used the acronym SMILE just to remind all staff to scan, move around, use proximity, use positive, frequent interactions, listen and encourage students. So now that we've been through those 6 active supervision strategies, in a moment we will get you to stop this training video and go to the handout and use it with your centre staff or individually as an audit of what current practices you have in each of those 6 active supervision strategies. So have a look at your current situation in terms of your environment. Is it set up so that you can see all of the students all the time and that they can actually see you? Do you have or do you need to implement a plan where you position educators in certain times of the day and use proximity? Do you also use scanning and accounting for children in your care now, or is there something that you could add to that? Are there any environmental modifications that you could make in terms of bells on doors and sounds that may alert and signals of danger for students? And do you have communication methods and around your children's interests, behaviours as well? And finally, do you have things in place or that you could put in place to increase the amount of times that staff engage, encourage, extend and redirect children in your care? Thanks so much for listening to this video today.